Yeah, well, but I just don't want people to be.
Right.
Thanks.
Lane, are you ready? We're gonna
Maybe
test
not,
this.
just don't talk about anything secretive, because I'm gonna see if this will go.
All right.
Okay.
Like, don't talk about anybody, may as well get.
Keep quiet.
Oh, okay.
Yes. Don't say anything?
I don't know.
Is it on there?
You know,
No, I don't know.
in a minute, there's sometimes a lag.
I can't use my own personality, you mean? Just
You can.
behave?
You can't.
Just behave? All right.
Behave.
Okay, Tom.
Yeah.
Okay, all right, bye.
Thank you.
We're good?
Yeah, we're fine.
I would like to call the Ways and Means meeting to order. Do roll call, Brian Muldrow,
Present.
Amy Sargent is excused, Robert Shea,
Sure.
and Mark Strong is excused. We could I entertain a motion to approve the minutes of April 21st?
A moment. Move. Second.
Any questions? All in favor?
Aye.
Great. We don't have any appointments on the agenda tonight, but we do have one presentation listed. We're going to be hearing from backed by popular demand. We're going to be hearing from the departments on a budget update of how their budget's performing to date in 2026. We're going to be talking to the Department of Social Services, the Health Department, and the Sheriff regarding their budget performance. Before we get into that, I think our Director of Finance has some information. Do you want to share that now?
I don't know if you want to do that or go through. It's up to you.
Would
It's part of the.
would it be relevant to,
updates.
would it be relevant to the quarterly updates?
Yeah.
All right, go ahead.
You want, okay,
Sure.
all right, I'll pass it down first.
Thank you.
I mean, I guess not relevant to what they're gonna update with, but it's part of.
It has to do with the budget performance of 26, correct? And this is the period of time up until the cutoff of,
Well, yes and no, because some of the things that I'm reporting on, like sales tax would be right up through May.
okay,
Chrissy, I don't know if you can put the finance part up yet, or,
Are you ready for it?
yeah, I mean, yeah, I'll go through mine. So, I mean, this is, there's not a lot here, just because we are only in our, really mainly our first quarter.
mhm,
What we did was we, did a lot of review. And other than the few departments you're gonna be hearing from, most of the departments currently, I mean, they're all performing within their budget.
mhm.
It's just too early. So I wanted to just highlight on a few things that I know from the finance department that we may have some shortfalls in, just so that we kind of have a heads up. Okay, thank you. Is it on all the way? I don't know. Am I too far from it?
You should be.
I mean, it's okay. I think nobody's got.
Just let me know.
Okay. So the first page is just the sales tax. One we always talk about. I did send out the May figures, and on the May figures, you see over last year through May, we are up 3.14%. Now that we're almost mid-year, I want to start forecasting out what does that look like. So with a 3% increase for every month for the remaining of the year, it still shows that we're gonna have a shortfall of about 660,000 in sales tax. Part of that is we were short last year. There was still an increase in the budget of 3.1%. So,
How much you said?
it might be higher than last year.
You said number? I think she said a different number though.
659. I said 660. I rounded
Okay.
659.
I thought you said 618. That's
No.
not a big difference. Okay.
No, but just not great news. We can always hope that, the sales tax, obviously gas prices are up. Costs are up, so that could change depending, but,
You normally see fluctuations throughout the year, so it's not just steady at a certain percentage, or totally varies?
It fluctuates. I mean, and then the state does their reconciliations a couple times a year. And that could, they've already done one and usually when they do the reconciliation, it's not.
In our favor?
It's not in our favor. And this time we're still up 3.14% over last year. So that's good news.
And they do quarterly reconciliations?
Without looking, yeah, it's not exactly quarterly. I think they do 3.
Okay,
One's in, I think maybe April and then, I can't remember when the other two
Okay.
are off the top of my head, yeah.
but you'll be watching
Yes,
how
we'll
this
be
goes.
watching and yeah, obviously you'll get your monthly sales tax, reports. So yeah, we'll touch on this again after the second quarter. The next one, I only have this slide, it's the adult use cannabis, just because it is new revenue to the county. So I just want to kind of look to see where we are with that. You see, we only received the first quarter payment in of about 72,000. The county only gets to keep 25% of that. So it's not a huge revenue generator, but it is new. But looking at it, we budgeted for the 25% for the county to be about 88,000 if I'm rounding, and it looks like we might be under that by about 15,800.
And
But that
that,
could change.
the total sales tax revenue is a 351. That's the total amount of revenue coming in, and then we get our 25% from there. Is that how
So the budget for the actual revenue is, yes, 351.
you budgeted?
There's an expense line that goes against that,
Okay.
right? So the expense is the 75% that we pay to the cities or any other municipality. Right now it is the city and there is one in the town of Victory, I believe, or Victory,
Yes.
town of Victory. Yeah, so they get a very small portion. But the 87,860, that is the net. So that would be the county's revenue. That's what we budgeted.
Mhm.
And I'm projecting that we'll have about 72,000
At this point in time
at
only?
this point in time.
Okay.
We'll see,
Yep.
you know, hopefully by the next time we'll have another quarter in there and hopefully it'll be more
So you projected 87 and you're expecting 72.
right now.
Okay.
Yes.
And that was for quarter one.
Quarter one, you can see the first quarter is the black line and that's.
17, okay.
Yeah, we received 72,000, that was the revenue, and then 75% went to the city and the town of Victory. And then the county got to keep the 25%.
So on the cannabis, there's taxes, right? And then
Yes.
the state holds the taxes and then cuts us a check.
Correct. Yep,
Seemed like that 72,000 would be more.
that's not sales, that's just the sales tax now.
I know, just thinking. Yeah.
And then it's broken down to the municipalities by actual sales. The state will send, when they send this payment, they also send what the sales are. And that's what the counties are used to distribute it.
So you disperse it.
Yep, based on where people are buying cannabis from.
Yes,
Yep.
or where, well, yeah,
Yeah,
where the,
yes, City of Auburn gets the most at this
yeah,
point.
they have 2, I believe, and then there's one in the town of Victory.
Okay.
Ain't there one in Weedsport? Is that Weedsport? Union Springs? No?
If there is, I don't think it's an officially registered one with the state.
The Cayugas don't count. This tax does.
Oh,
not
yeah,
apply
yeah,
to
yeah,
the
okay, yeah,
Cayuga
yeah, okay, all right, all right.
It's
All right.
okay. The next is our interest earnings. I mean, that one we like to keep track of just because it is, you know, larger revenue. Right now, I'm looking that we're gonna be under budget by about 117,000. That could change, you know, we did take in, you can see kind of the fluctuation. I did highlight in April, that's kind of where we are right now year to date. That's actuals. And then I really just did just forecasting and it's obviously really a stab in the dark. It depends on how much cash we're paying out and how much we're able to keep in the savings accounts. But I can assure you, we do work closely with the treasurers and literally keep cash and savings right up to the day we have to pay things. So we're really trying to monitor that and
Maximize it, yep.
the next page, I'm not gonna go into this in detail. This is just other miscellaneous revenues that we hold in the finance department. They're not really related to the finance department, they're county revenues. But I do keep track of them, and some of them are larger. You see the total for these specific ones is almost 2 million. So, we kind of pay attention to those. And it looks like we could potentially fall short in the retiree drug subsidy, but the off-track betting and the workers' comp refunds looks to be a little bit higher. So overall, I think those revenues will come in to where we budgeted. So that's good news.
And the Oneida Gaming distribution, there's still that account that exists, and that used to be an account that the county could, what is that?
That's the exclusivity payments that we receive for the Oneida, for the gambling
Yes,
casinos.
yes.
So yes, no, and actually last year we increased the budget because there was news that that money or that revenue was going to be slightly higher. So, yeah. The next is an actual expense account. It's the assigned counsel. I did have a conversation with Lloyd. We have payments in there. He was able to give me what he knows he's going to be put in through June. So I actually have actual numbers through June. And we are slightly higher than last year, but he is projecting that it is possible that we could end up at about 2.8 million, and we only budgeted 2.6. So I still only have us over by 100,000 because he did say there were a couple big ones that we've already paid off, big cases. And hopefully we won't, see any additional larger cases, but.
And you and I talked, he didn't think the new $270,000 additional revenue that he just got for family court cases.
It's
Would
my
be a help.
understanding they're only for specific cases,
Yeah.
so it's not gonna cover all of this. I mean, he could probably,
Okay,
I don't know if he's on, but. So we'll keep an eye on that because obviously he'll have to come forward with the resolution if
his count falls short.
Yeah, if he goes over, or if he looks like he's gonna go over it in his budget. The last two slides really don't have anything to do with the budget projection, but I know this has been a topic of conversation, so I thought it would be good to share this information so that you guys have it. It's the occupancy room tax. I mean, obviously it is part of our budget, but what I did was this first slide, I broke down the top is the actual occupancy tax that we take in, that gets recorded in our financials. And gets paid to the county. And that line that's highlighted is where we are year to date. So you can see that year to date 26, we are slightly ahead of 25 by about 40,000. Hopefully that continues and, we are up over last year. But at the bottom, that's really the only that's the county revenue. So we don't get to keep all of that. The county revenue on that is really only the 67,233. So
Okay.
I am showing right now, based on what's in the blue, and I'm using the same increase that we have currently year to date to project out, we are going to be short by 5,000. So I mean, to me, we're pretty much meeting the budget there.
And when you say we're going to be short, basically tourism would recognize potentially $5,000 less, but it's far too early.
Well, yes,
Yep.
we would keep 5% of, obviously, we would lose 5% of that, and they would get the rest.
Okay.
And then the next page I just did was a 7-year comparison, just so you can see where we were back in 20, where we are now in 26. The top line is what we budgeted. Then our actual numbers for our occupancy tax. And then whether or not we were over or under budget.
It's a good job, Grace.
Yeah.
And then the bottom half is our county revenue. And then the bottom line is what goes to tourism. So you can see that back in 20, it was 547,000. And this year I'm projecting it'll be almost 1.3 million.
Going back to tourism.
Going back to tourism. And we went from keeping 28,000 to 67,000 of all that money. So.
And we were talking that at one point there was and I think Dave was talking about it too. There was a discrepancy on how they were accounting for the money and the county was, and that they thought they were going to be under more
Yes, so I think-
significantly?
Yeah, so I think they were going off of the budget of 1,350,000. So you can actually see in 25, there's a shortage of 88,000.
That's what I remember she referred to.
That is it. And we kept 4,000. They actually had to do an $84,000 adjustment on their first invoice for 26. So they're gonna probably be short for 26. I had to record it in 25 because it really pertained to 25's occupancy tax. So it's in that 1.198, that's in our 25 numbers that you see here. That's already reflected in here. But yeah, that's what you were talking about earlier.
Where is the portion we keep? Because you said the number is
So
not a.
see the 5%
Right down here.
treasurer fee?
Yeah,
So that under projected, I'm projecting we'll keep about 67,000 of that.
of the 1.2 million.
And that's basically for alleged administration of tracking it and,
Yes.
Mhm.
And Brian, I'm sorry, did you say up to 1.2 million?
Yeah,
No, up above of the projected 1,344,000.
okay, so this number that we're collecting, in that number is basically admin fee for us, correct?
Yes,
So this is not really profit. This is us working,
correct.
keeping track of the numbers. So we're not really making anything.
Right, it's covering, yes. Yep. All the administrative work that the treasurer's office does
Yeah, it's
to
not,
record that.
not an extra revenue stream. It's just simply covering our expenses.
Correct.
Yeah. Wow. Well,
That's all I have.
as my friend Elaine Daly would say, ain't horrible.
Lloyd, we were just talking, Grace just went over your assigned council accounts. And I was thinking more optimistically that the additional 270,000 that you just got to help with family court cases would put us in a better position, but not so.
I don't think we're gonna get it up and running. It'll be September before we get it up and running, so I don't think you'll see an impact.
I don't know what that means, get it up and running.
In terms of the grant, I mean,
Oh.
we still have to have legislative approval next week out of here. Then it goes to the comptroller for their signature, which,
So the 270 won't come just because you talked about it.
Correct.
So all of those steps are taken.
yeah. So I think implementation will be later this summer.
Okay.
But I don't think you're gonna see the results of that until you may see it in the 2027 budget.
More of an impact than on 26.
Boy, does it go against all of these cases or?
No, it's just the
Family
Article
court.
10 court cases.
I mean, we would do anything to expedite it, obviously, but there's just some things are in our purview and then the rest have to go to the state. Okay,
We'll get it in gear once the comptroller sends off.
okay. All right, thank you. Thanks, Grace. Of the three departments that are going to present today, does anyone want to go first or? Huh? You'd like to? And again, we obviously are looking based on 2025, where the biggest budget pressures were. Obviously, there was foster care within the department. I mean, it's no shock to anyone, no blame game either. And, I think the health department is here because primarily for the education of physically handicapped children and the transportation costs associated with that mandated program. And then, we had some budget pressures with the sheriff's department and the staffing. So we're going to kind of be more focused on trying to see, where we stand as early as possible. Not sure what we all can do all about it, but at least it'll be on our radar.
I passed out 3 papers. I didn't go the route of doing this munis report at the.
Yes.
So I haven't focused, like you said, on some of the budget pressures, and you want to talk a little bit about some of why we think those areas are difficult for us to manage and some strategies that we've implemented. So I did do the overall performance at the 3-month mark, which like Grace said is tough because we're only 3 months in and based on, you know, what we're seeing right now, it looks like we're doing great. So I don't want to give anybody false hope that, you know, we're
Out of the woods.
yes, right, yes, but I did do the sheets that show where we're at for the 2 program areas we're gonna talk about, which is safety net and foster care, but the top box on your handout talks about, you know, what's in the 2026 budget as far as expenses, reimbursements, and local share. We did it year to date through March 31st. And that shows that we've used up 17.6% of our budget at 1/4, you know, the way through. Overall.
Okay.
Total everything.
So
So that's the bottom line of the budget.
just so I'm clear, in 26, the local share of operating the Department of Social Services, including the 14 million for Medicaid,
Yes.
Yes.
okay, is $27 million
Yeah.
and 14 million of that is our share for Medicaid.
Yes.
Okay, so that is what is in the 2026 budget is the county's local share for
Yep.
DSS.
Yep. And then the middle box is year to date, what
Mhm,
our expenses have been,
mhm.
what our reimbursements have been, and how much we have spent local share. Does that make sense?
Yep. Yep, so you have 82.4% of your budget remaining,
Right,
and the devil will be in the detail as those costs come in.
correct.
Yep,
So we do want to talk about salaries. We're coming under budget due to the vacancies. We have a lot of vacancies right now. We have 110 employees on the payroll currently. 127 positions are budgeted. So we have used quite a bit less in our salary line.
Yep.
For our full-time and part-time than would be anticipated if we were at full staff. We do have 7 caseworker vacancies currently. I talked about that a lot at the HHS meeting. That's, you know, the book for both of them are the caseworker positions. Overtime, even though we are down on staff, we are coming in under budget for our overtime expenditure for year to date. Only 17%.
say that again, I'm sorry. Overtime, you're under budget?
Yep, we're not spending a lot on, like, way more than we think that we would be at.
Okay.
Quarter of the way through the year on overtime. So that's a good thing. Any questions about that?
So you think we're gonna do here in a simple kind of scenario? Order is 25% of the budget, but you're at 17.
17, yep. So the next bit talks about just kind of some information about the DSS received allocations and reimbursements from the federal government and state government. The amounts of the allocations and the reimbursements that we receive are, when we do the budget, we're doing a budget prepared. It's estimated based on things like program caseloads, historical data, what we get, the information in ADM about how they calculate the amount that we're gonna get for allocations and that we receive. However, it's definitely not a easy thing to figure out what we're going to get. And the actual amount we receive can be more than we think that we anticipated, or it can be less than we anticipated.
Talking about the block grant now.
Talk about
Yep.
a few of them. We'll talk about the foster care block grant. We don't know what the foster care block grant allocation is going to be for the state fiscal year 26-27. We'll find out what that's going to be in late summer. So
The hope would be because the costs have been driven up, that potentially the block grant will be up, but who knows?
right, and I think that for the foster care block grant, it's a 3-year look back period.
Okay.
They do some sort of a calculation, and honestly, it's kind of a mystery, like how they decide. Like Lynn said the other day when we were meeting, she's like, we could get 500,000 more, or we might not get 500,000 more. You just kind of don't know. Grace is shaking her head. Yeah,
And if you look at the historical data, you can see that some years when we thought it would go up, it didn't, it actually went down. So,
And you can, we've talked about it when we all met and, Tom was at the meeting as well. There's this block grant, that's a capped amount of money we get. And if we spend over the block grant, it's all local. I mean, that's why the state says pushing you into preventive services, because it's open-ended funding.
Yep.
Because if you spend more than the block grant, That's all your.
Yes.
Okay.
So like I said, we'll know sometime late summer, July or August, what we're gonna be getting for that foster care block grant. Similar for the New York State Child Care Block Grant, the allocation for the SFY 26 hasn't been released yet either. Maybe we're gonna find out soon if the state budget settles, so we can find out what that's going to be. But really what's important about that is that this is a program area that we don't spend local dollars. And so we've been making changes recently around how we're implementing the program, who's able to receive the child care assistance program to try to keep it at no local dollars. So we've had to make some changes where we've shut down new applicants, and for a bit of time, we actually closed for new applicants, and we weren't recertifying people that were coming up for recertification of their case because we were going to have a fight. We just have been able to implement starting June 1 coming out recertifications again for the cases for June, July, August, and September. And that will keep us under our block grant.
With the restricted criteria on those,
The federal, they have to meet the
Yes.
federal thresholds, yes.
and you know, we say, oh, yay, but for families, it's very
devastating.
it's terrible. Yes.
So how's that impact families?
Don't you get any?
No, I mean, like exactly dollar wise.
Oh, the cost of childcare, it's if they qualify for a childcare subsidy, when the way that this works for the childcare assistance program, their childcare gets paid for by the subsidy, by the childcare assistance. And with not having that, they're left on their own to be able to, pay for it themselves, or if they can't afford it, then yeah, devastating that they're not able to, they have to make plans in their life to have someone else take care of their child, or we've had people say they've had to stop working.
Yeah, that was the real thing, yes.
And does it impact the foster parents equally, or is there a different program for them?
So we were utilizing the foster care block grant for foster parent subsidy. So the foster parent is working and had a child that needed childcare in their home. We were using this block grant for their subsidy. Now we're not able to do that. The way that the changes that we've had to make because we've, closed down, new cases, we've had to kind of pivot, and we're using other funding that we have at not 100% reimbursement for foster parents to receive subsidy for their children that need childcare.
So this terrible decision was made at the federal, state, or local level, like is it because of our budget? Is it because of the state and federal mandates?
The root of the problem is that the childcare is very expensive. The state raised the threshold of income that a person could make to a pretty, it's still, what it is.
It's over 200% of federal poverty, isn't it?
Yes.
Oh, it's.
I think it's even more.
How much is it?
300% of the poverty level. It's 300% of the poverty level. So a family, there's a whole criteria of how many people are in your family and what you can make to still qualify for the subsidy. They raised the amount of money a family could make and still get the subsidy. So people were coming in more to apply for the subsidy, and they were using the money that we were allocated, about $2 million, much quicker than we ever have in the past. So we've run out, where we've never run out before.
And they paid 80 days of absences
Yeah,
or
it's
something.
a lot of the
Yes.
criteria with how much, how many days that you pay for absences when a child is not at the childcare because they're ill, or even that the parent is ill and can't get the child into childcare. And it's changed everything.
Do you have a sense of how many other counties put local money into this? I mean, we never put local money into daycare, correct?
I guess I wouldn't be able to say I have a sense. I know there are some, and I know that there are some that put substantial money in. I know that there's also counties that are like us that are working really hard to not have have a local cost because of their counties, that their decision as county to not put local funds into it, but it is, there is an impact on families for sure. We don't know what, the block grant's going to be, and one of the things that we wondered based on things that I've said is it's going to be based on how much we've used of our current allocation, so that's why we really want to make sure that we're using as much of it as we can so that we can get hopefully at least the same amount for next year and not less. The flexible fund for family services, triple F, we call it, the allocation also hasn't been released. And that's a substantial amount of money as well, $5 million. So those are things that really kind of they impact like where we are during the year based on, you know, when these allocations are released and how much we're going to be receiving. So like you said, Elaine, areas that we need to watch closely in the Department of Social Services budget is primarily two program areas, safety net and foster care. Safety net is mandated DSS program that provides financial assistance to qualifying single individuals. The reimbursement rate for that category of eligibility is low, it's only 29%. And within the safety net program is the high cost of emergency housing in hotels and shelter for individuals that qualify for that. That's one of the biggest components of the safety net expenditures. The back sheet of your little packet, box on top talks about what we have spent on safety net through 3/31. That's $1.4 million. And then what we did was we projected out if we spend at this rate for the rest of the year, we would be projected to spend over 5.2 million. And our budget for 2026 was 5,540,000. So it looks like, you know, we're doing well, but I don't want anybody to think that we're thinking this is what it's going to stay. I mean, it can fluctuate based on how many people are coming in the program, how many people housing. So right now looking good, but it is very early in the year. We'll continue to look at this.
Was there an increase in the budgeted amount? Do you remember from 25 to 26, or I'm just curious if.
I think what we asked for is actually less than what was actually budgeted.
Yeah. Last year we came in pretty good.
It's like 288 only
Yes.
over.
Yeah, pretty close.
Okay.
So hopefully this will stay
Yep.
on the right track. The other program area to talk about is foster care. Again, it's a mandated DSS program area. Potential to go over budget or significantly over budget due to a number of factors. One of the things I talk about a lot is about children that are removed from families and placed in foster care by court order. Our obligation is to place the children in the lowest level of foster care setting that will meet their needs. Some children are able to be in a regular family foster home setting, and other children have very complex needs and have to be placed in a higher level of care that are a residential based program where they get a high level of support services. That high level of supervision and support comes at a very expensive cost and can even cost over $1,000 per day.
Jeez.
We don't have any control. I was asked this question recently. Do we have control over the rates that the program charges us? Can we negotiate with them? And that answer is no. We're not able to negotiate rates with the programs. They're set by the state and they do get increases every year. They're going to be getting increases in July and we don't know what those increases will be. They'll be back billing us once they figure out what the rates will be, and you know, we have no choice but to pay that. So again, like that's talks about impact in our budget down the road for expenses that we're incurring like earlier in the year. The other thing about foster care that is can have a big impact is the level of reimbursement that the department receives for a youth in foster care varies greatly from not a lot of funding to some funding. So 50% funding to 100% local share. And the way that the case qualifies for reimbursement, some of the things are, you know, before the child even came into foster care, things that were going on in the house as far as their level of income, who the child was living with, things like that we don't have a lot of control over, but does impact whether they qualify for 4E funding, which is federal, which is the highest level, the one we want to get if we can, and, or EAF, foster care funding.
And 4E is based on the income of the family at the time the
Yep.
child comes into foster care. Right.
So as of May 1st, we had 88 children in foster care and 11 of them were placed in a residential setting. There's a number of different residential settings, but we have 11 of them in the different types of residential settings that we use. So,
Is the 11 higher than usual for typical?
we've been around like 8, 9, 10, 11. You know, I think 2 of these are in the group home placement that we have with Cayuga Center, so it's really 9 of them that are actually in other types of residentials, QRTPs. One is in an old age facility. So I can't remember when I shared this information, but we kind of took a look back to 20 years to see where our residential numbers were. We are lower at this point in time than we have been in a long, long time for residential. The thing about residential that has happened most recently is the increased rate it's been an exponential increase. $1,000 a day wasn't something we ever saw before. We saw, one of the providers that we use, went up from $200 a day to $800 a day, within like a 6-year time frame. So it's the cost per day per child that has gone up so much. So the other sheet I gave you talks about our 2 different types of foster care expenditures. We have EAF foster care and then our other foster care line that we broke out to show our expenditures through the end of March. For EAF foster care, it was over 900,000, and for the other 6119 foster care line, it was a little bit over 1.4 million. So total cost for foster care through March was $2,343,905. We use those figures to project where we would be if we spent at the same rate all the way through. We came up to just shy of $11 million. And we budgeted in our DSS budget, there's $11,900,000. So that, again, it looks like we're doing pretty good, but it's very early and we need to just keep an eye on this and continue to work on the strategies that we've worked on recently. And I put some points at the bottom just to highlight again, what we've been doing recently to be more to not pay more attention because we're always paying attention, but to just put some strategies in place that will help us to highlight this area and to just continue to look at it. And some of those things are enhanced monitoring of the residential pieces in particular by the upper management level at DSS, including our director of services and Jen and myself. We developed a detailed tracking spreadsheet that has many fields to be able to take a look at any point of who the children are that are in our residential placements again in particular, and just track a bunch of information about what kind of eligibility they have, how long they've been in placement, what are we working on as far as their permanency goal, what are the barriers to achieving that permanency goal, and what action steps we have in place and are working on to try to work on anything that we've thought of to try to achieve permanency or work on a lower level of care stuff done. The director of services is meeting weekly with the foster care supervisors and caseworkers to talk about these cases and the stuff I just mentioned, progress and barriers to achieving permanency, action steps. What can we do? Is it possible to get this child into a lower level of care? Have we sent out referrals? Have we followed up on referrals? Have we gone back at it again if they said no 6 months ago? Just to continue to put the pressure on to make sure that we're doing everything we can to meet the needs of the child at the lowest level of care possible. We're also going to be contracting with an individual who told us that they're interested in becoming a qualified individual to complete assessments on children that are in residential placements. The assessments are required by the state as a way for to make sure that the child is at the level of care that's appropriate for their needs. So this qualified individual has specialized training and background in child welfare that allows them to be able to take a look at the needs of the child and help determine and verify that this is a level of care that the child needs to be at. The assessments are due periodically when a child's in care, and they have very strict timeline requirements that if you miss by a day, you lose funding forever for the case. So it's very important that we have these assessments done when they need to be done by someone that's able to complete them timely, get them to court timely, and so we don't risk losing funding. And we talked about getting together with family court judges to talk about some of our challenges and also ask for feedback from the court around what do they see anything that in our case practice or in what we're providing them that they want to give us feedback on, anything that they think we can do a better job on or things that they think that we need to just do things a little bit different to help give the court that information that they're looking for to make decisions on returning children or documentation that's necessary or when we're bringing things into court and having hearings. So I actually have a meeting tomorrow with one of the family court judges. We do. We're going to go meet with one of the judges tomorrow at 4:00 with our DSS training.
Well, that's great.
Yep.
And when the court puts the child in care, it's a 12-month order, but you can go back in and say, we've made some significant progress. We don't need that 12-month. I mean, is that just traditional foster care?
Traditional neglect and abuse, abuse for neglect case that goes into family court, it's a 6 month, well,
6.
even sometimes more frequently than 6 months, I'm not gonna try it.
Yes.
But typically it would be on a 6 month track to go in to review the child's
Back into court.
in a permanency hearing to
Okay.
review.
Mhm.
But with it, before that, you get to that court appearance, if the department's made a decision that it's safe for the child to return home, we don't have to wait through that whole 6 months. We can.
Ask the court to hear it sooner.
Or we can do a
Yes.
child discharge, if there's things that we can do to shorten.
Can and would.
Yep, can and would, yes.
Yes. Okay.
There are case planning meetings within that 6-month period that are done internally to help track as well.
Talk about all those things, same things, like why can't this child go home today? What are the
What are the
services
barriers,
needed, what are the barriers, how are things,
Yep.
So I thought that was important to talk about, what we're doing to monitor, because kind of where we're at today, although it looks good, I mean, it is something that we can't sit back and, just think that it's gonna roll that way through the rest of the year. We need to be aware and I think these extra layers that we've implemented recently will help us, will help us.
Yeah.
And we know we'll be able to give more information of, when we're through second quarter, to report out.
Yep.
Thank you.
Thank you.
Good job,
Appreciate it.
guys.
Thank you.
Hard work.
Kathleen or the sheriff? All right.
Evening. I passed out the handout. So last year, the biggest challenge we had was overtime in the jail, just like this year, we're seeing that trend continue. And that's the same thing that we're seeing this year, but I did include the first slide, just a quick slide about building maintenance. We look okay there. That's an area that sometimes we have some challenges, but I did put that in there just because we've had a couple of large projects. I know we're kind of continue to push them down the road. I just don't want to lose sight of the fact that we need a roof on the blocks in the jail and also our chiller. We've talked about that in the past. It's only 26 years old. If that were to go down today, we lose half our jail for the summer. So I just want to keep that on your radar, even though, our maintenance line looks good. This doesn't take care of some of those large maintenance issues that we've got to keep at the forefront.
This is all 2026?
It is.
And how do you have a revised budget already?
So that would be like carryovers from last year, like maybe PLOs and
Okay.
things that were approved last year, they carry over.
Oh, they hadn't been spent, so those monies come into your 2026 budget. Okay.
That's the revision.
Did you say your chiller is 26 years old?
It is. It's significantly, we maintain it to the best of our ability, but just when we talk about that, I mean, we only kick a can so far, and I just bring that up.
Kick that can as far as that can go, 26.
It's getting there. We've talked about it for the last few years, and we just keep postponing that, but if that were to go down, it'd be a pretty big deal. So I'll make sure we keep that in mind moving forward.
Do we have an idea what that type of size chiller would cost? Do we ever get an estimate on that? Cause I don't know what size chiller what.
Amanda, have we got anything recently?
I don't have my spreadsheet with me, but I do have budget number in there. It's a lot. I can send it to you.
Yeah, can you email it to me?
I don't wanna throw a number out there and be completely wrong, but it's significant. And there's a very significant lead time on getting something like that as well.
Yeah, it could take some engineering work and some things like that. So I bring that up because it's a project that we really need to be thinking about moving forward. It's not something that's gonna get done before the summer, but we need to be thinking about it in the years ahead. Next slide. What you got right there? So the jail overtime, with a lot of pressure with the jail right now with overtime. I've talked to the legislature before about a number of positions were down. I do have those on the next point out when we get to that, but we do have a significant number of vacancies. We also have people in the academy, and we have some people that are out with some long-term injuries and out sick. So we've had a lot of hospital details, medical transports, things that really weigh on our budget when it comes to overtime in the jail. As of mid-April, we've used almost all of the overtime budget for the year. We are going to have some significant salary savings, but it's certainly not going to offset all of the overtime that we're paying. So that's going to continue to be a very pressing issue in jail.
And if at some point, and I don't know how we're going to handle this, but at some point, when the discussion is when the lines go, when you've exhausted the line, then you would bring a resolution forward. And I don't know what the plan would be then to, at least before we hit fund balance, move some of the 0.1 down into the overtime line. I mean.
Yeah, this would be a Lynn question, but I would
Yes.
assume some of that salary savings we would move into.
Yeah.
Grace.
That's probably what would happen first, is to move some of it and then.
Because the last resort is fund balance.
So we're gonna need to do that soon. And just to give you a snapshot, this is today. Our A-line shift, 10 o'clock last night till 6 this morning, we had 2 voluntary people on overtime. 1 person was held, mandated to be held because we were short. Our day shift today, we had 7 on overtime, 6 were voluntary. I'm gonna take that back, 6 full shifts, 1 partial shift. And on our C line, we had to hold 1 because of a medical transport and 5 voluntary overtime, people on overtime. That's just today.
Do you have hires in the pipeline, Sheriff?
We have a few, but not a large number. I'm anticipating losing 2 more in the next 2 months, 2 females. That's becoming very challenging too. We have to have a female deputy in the building anytime there's females housed there. And that's becoming extremely difficult and challenging to maintain. We're down to 12 female deputies and we're going to lose 2 more. So if we don't fill some of those positions, we're going to be looking at the next few months and pushing some of the females or all of the females out, having to board them out and losing some of our board and revenue for the females that are coming in.
What would you say, just off the top of your head, the number of males to females is, right? I mean.
We have, I believe, actually on the next slides here, I have a. Currently, we have about 14 females, 219 males. We usually fluctuate between 10 and 20.
Mhm.
And we have been boarding in quite a few females recently. That's been a big part of our local share revenue. But we would have to push some of them out if we lose.
For the same reason the other jails might say the females got to go? I mean.
Tompkins and Jefferson County, it's been primarily their jails that we've been asking for. So they're having some staffing issues, I believe. In those positions. So that gives you a snapshot. And also today we had a number of, these are details that pop up daily. We had 3 medical appointments. 1 was in Syracuse, 1 was in Portland, 1 here locally in Auburn, and then 2 incarcerated individuals that had to go to county court. So we had 4 separate transport details that take 2 people for each detail. And they pop up on a daily basis too. So sometimes they're sticking people and holding for overtime for those. So it's just, we've got to somehow figure out a way to get some people hired to offset that.
You had brought up the possibility of HR assisting with an actual firm or, I mean, and that's can be considered and is being considered?
Yeah, really.
Okay.
Yeah, I think some professional recruiting help.
Mhm.
We're trying to do all we can with open houses, open interviews every Thursday. We're inviting people to come in. We're doing what we can on social media. But I think we have some other challenges too that, you know, we need to continue to push forward with. The contract being out, you know, I think there's things that we could do to help with that. But that's another challenge. So until we fill some of those open spots, we're going to continue to be, you know, crushed with this overtime.
And when we talked about the Department of Social Services, the local share is 24 million or whatever, including the Medicaid. I mean, that's why it's so critical to get these positions filled. I think the local share of running the jail is over 13 million now. I mean, I don't even know what it is for 26, but it's up there.
It is.
Yep.
And every day, every shift, we're filling multiple posts with overtime every day.
Mhm.
And when these transports pop up, I don't have extra people that are earning straight time to do them. It mandates another overtime position. And when we have somebody in the hospital, that's 2 people every shift in the hospital in addition. So it's not manageable. We can't continue to do this.
And there's no movement, I know, because the contract isn't settled on, and you told me it's not going to be the Mecca, but even if you got some part-time staff, you could at least try to get some coverage at straight time.
We would try to get some part-timers. We've talked with some of our retirees. I think a couple of them would be interested in working a little bit of part-time.
But it's a subject of collective bargaining. Is that what I'm hearing, that it's exclusivity or whatever?
We're working on that with it.
Oh, good. Okay.
And then you probably don't want to get into this, but the next page just gives some information relative to some of the challenges we're having with staffing. And I don't know if you want to talk about any of it today or down the road. If somebody has any interest, I'm happy to
Covered
go
it.
through these things.
Mhm.
But, you know, I would invite anybody, any of the member of the legislature, if you want to come out and work with our classification officer or be there for a few shifts and not just do a tour, but really understand how the classification process is really tying our hands with, you know, shutting down certain parts of the jail, we would welcome that.
Can you give an overview of the classification? I really don't understand. I don't,
Sure, there's different levels of offenders, so low, medium, high risk, depending.
but how's that
And
impact?
it's based on an assessment you do of them?
It is, so
Okay.
we assess them when they come in. We can't put like, you know, the lowest level offenders with your highest level offenders. We can mix the medians and highs or mediums and low, but we have to keep the lows and the highs separate. Sex offenders have to be separate. Males and females have to be separate. If there's orders of protections or keep apart issues with inmates fight or we dealt with them in the past, they have to be separated. We have very challenging incarcerated individuals with mental health issues that need to be by themselves. They just can't be around other people. So they take up areas by themselves. So there's all different types of, you know, classifications, and it's like a puzzle every day that changes. We have to move people around.
And you have that, you can opt into having a classification system, or you don't have to, or I don't even know how every jail must. And there's some incentive for having
We
classification.
do, we get, I think it's for the, what is it? There's some funding that comes with that. It's stumping me right now, but yeah, by having those 3 separate classifications, we get some additional pretrial, I think it's some pretrial funding. What, you know?
Alternatives to incarceration or something?
Incarceration.
Get the sentence.
Yeah, sentenced and unsentenced folks, but yes, there's some advantages for us to have 3 different levels of classifications.
But it certainly makes operating a lot more difficult.
It does, but we almost have to separate people that
Anyway.
way anyway. We can't just put them together because we have issues,
Okay.
but it makes it very challenging. Moving forward to area closures in the jail. When we're able to close an area, these are the times that we've been able to close certain areas of the jail for a period of time. It alleviates the need for staff in that area, so we do try to do that, but it's been challenging with the classification puzzle that we have. We did recently, the most recent closures that we have is our dorm area from 12:22 to 1:30. So we continually monitor that every day. And, you know, if we can close an area and not have to fill that post, we do. Unfortunately, it's not something that we can do on a regular basis. Next slide. That's a little hard to see if you are able to. I can get you better copies of that if you need them, but it's just to show you, if you want to look at that later, it's a snapshot of the current jail population mid-May this year, and then going back to July of last year. It just shows you the fluctuations we deal with. We're a little bit lower now, which is a good thing. But when we're thinking about trying to, you know, close areas of the jail, we are still seeing fluctuations where we, you know, July of last year, we went up, and you can kind of compare the different classifications there and how they fluctuate throughout the year. Summertime, we usually do see an increase in the number of people we have. So moving forward, you know, a lot of that overtime is driven by, you know, the medical needs and hospital details and transports and all of those things. When they happen, we just don't know where we're going to be. We'll have to continue to watch that moving forward. But we're gonna continue to have the challenge without enough staff.
And unlike Christine had put some things together that were strategies. At this point, there's really not a huge amount of strategy, except you have to have bodies
There really
that
is.
that are paid at straight time.
Right. Yeah, we need people that are filling these posts. We really are we're filling the minimum number of posts to make this work on a daily basis. We don't have extra people that we can say, you know, we're not gonna fill that post today. We're working at the bare minimum, but we're paying so many people overtime, 10 and a half, it's adding up. The revenue, that's where we're at through the end of April with local and Fed revenue. We're down a little bit from where we would like to be, but that fluctuates through the year too. My concern with this, if we have to push females out or push up, that we don't have enough staff, or our revenue projection is going to be severely impacted. So that's something else that we're going to need to watch, and it's a concern as well.
And the challenge to offset what you're paying in overtime, what you're losing in revenue. I mean, it's difficult.
It is, but it's as I pointed out before, we have a classification puzzle. We have our jail set up with our own people. If there's open space in an area that's open anyway, we're trying to plug borders in there so we can generate revenue. We're not opening separate areas so that we can house people for other jails. We're trying to plug people in where we have space already. Make sense?
Yeah, it does.
We did raise our local boarding fee to $90 an hour from $80 here a number of months ago. And we're actually working with the feds right now to raise the number for the marshals too. So that's currently 100, but we're going to try to raise that.
If you look at this chart with revised budget to the actual budget, it's gonna be tight the last quarter.
Which budget? The whole budget overall?
Yeah. It's almost dead on, or gonna be a little under.
Well, it's a little bit deceiving because we're early in the year again.
Yeah,
You're on the next page, right? After the revenue.
I'm on that page.
Yeah, it's a little bit deceiving because there's there's money in the budget that we're clearly going to spend moving forward that hasn't been spent yet, but yeah, we're gonna
Be tight.
if it weren't for the overtime issue, we'd be in great shape. But there really isn't any other line I'm concerned with other than the overtime.
Yeah. Overtime's killing you.
We just need to try to fill those positions. That's it for the jail. We're in pretty good shape with the road. Auto expense, I did put that slide up there only because we're going to be watching the gas price. That's going to be impacting our budget when it comes to the auto expense. We put a lot of miles on, and I'm concerned as to where we're going to be at the end of the year with gas, but we'll have to report on that mid-year so we know a little more. Road patrol overtime. We're going to have some salary savings there. We are down 4 positions there. So I anticipate that we should be okay there. We did just have a retirement. Obviously, you're all aware our K-9 sergeant retired. a lot of overtime with the canine handler and maintenance of the canine and training. We're not looking to fill that position, obviously, right now. So there's going to be much less of an impact on our budget there. And I think with that salary savings over the next few months, we don't have a list of eligibles right now. We just gave the test on May 9th. So it's going to be a number of months before we can even try to fill those positions. So there's going to be some salary savings. So I think that we'll, unless barring no major incidents, I think that we'll be okay with overtime on the road.
You could be in the same position you are with the jail, that at some point you'll have to transfer from the salary line to the overtime line.
I'm thinking it could be a possibility because we do have to cover some shifts with somebody on overtime, but I think, as long as we don't see a number of positions vacant like we do in the jail, that that'll somewhat offset itself.
And I'm asking, you do have more discretion on jail or road patrol overtime than you do on jail.
We do. We're not doing as many community outreach details and we just don't, those kind of things we're saying no to. Unfortunately, we just can't do that. I know the community would love to see that, but we can't do it. We put out our most recent community survey. A lot of people, the biggest thing we get a request for is proactive speed and aggressive driving enforcement. Try to do that when we can, but those are things that we just will have to tell people that we can't put a dedicated car out for because we don't have people to do it unless we're paying overtime, and we just can't do that. So you might hear from some of your constituents, I want more coverage for that kind of thing and I'm not getting it, or more coverage on the lake over the summer. They're not going to get as much as they used to. Those are the things we're just going to have to limit. And then the last slide, overall, the road budget is similar to where we're at with the jail. I really don't have any concerns with the road or any of our other divisions. It's just, again, just keep watching that jail over time. And if we can work on strategies to fill positions, I think that's what we really need to do right now.
Okay, any questions?
What is the minimum qualifying age for us?
So in the jail now, it's 18. We just changed that. We haven't hired anybody that young yet. However, I'm a little concerned about how much they can actually do. What kind of impact that they can have, but we did just get that changed. So we'll be looking at potentially advertising.
For a mature 18-year-old?
I'm a little reluctant, to be honest with you, about that. It's something we haven't done yet. And
Life experience.
I don't want to just race into that without really thinking that through. Sure, somebody's ready for that at that age, but.
Tough situation to be putting somebody in.
Yeah. It is. So I know state docs did that. We followed suit, but we haven't hired anybody at that age yet.
Yeah. 3 deputies, I realize it's a very small fraction of the 21, but the 3 deputies that are in the academy, they're due to come out in June. Is there a while after that before they'll be able to offer relief of any kind?
So actually, some of them had actually worked prior to going into the academy. So we are able to hire individuals, actually train them in-house with enough training to put them on the floor, and then
You're talking about jail?
the jail.
Okay.
And then by law, within a year, they have to go to an actual academy. So some of them have already had some experience on the floor. They will offer some relief.
I do know it is a small fraction of the 21.
And what experience are you saying? Like if I was to apply or someone was to apply, what experience would it be where you could give them this kind of crash course?
Well, if we've hired people with all varying types of experience, we can actually, they don't have to go to an initial academy to actually work in the jail. We give them enough training so that they can safely.
Oh, so that can happen with anyone you hire?
Yes, anyone.
Okay.
Yeah, there's no criteria.
And you do that obviously if you could.
Well, we actually do. We've hired a number of people and then they work for a period of time. Once an academy becomes available.
Yep.
We'll push as many people into that academy as we can, but the academies are staggered. So
Okay.
we just, we'll utilize them in any way we can until that academy becomes available. But we have to get them in a year, they lose their certification. We have to send them. But that's more of a strain right now too, because they're in a 12-week academy and we don't have them. That's 3 more positions that we have to fill in overtime.
Okay, thank you.
Thank you.
Sure.
Hello.
Deanna's passing out packets or Lisa, you can hear. I don't know if everyone's, I think most of you have met Wilson Bacon. He's our fiscal manager. I know you're all agreeing.
Does someone have two?
Oh, like I had two. This thing's thick.
Yeah, okay.
I got one.
I want to thank Rosen for putting this together for us. We'll kind of go through some of the highlights, and for any questions that you might have. And I'll refer to the page in the bottom right-hand corner when we're talking about pennies. So we'll start with page 1. Everything's to be expected where we're at. We have a little higher than typical in our fees because a lot of permits are paid at the beginning of the year. Our state aid first quarter was submitted for Q1 of $469,000. So we will be getting that in fairly states. Got a pretty good turnaround time for that. But of course, as you know, sometimes things are delayed because the state budget's delayed. Page 2. We'll look at salaries. Part-time, overtime, on-call, right? They're about where we expect, there'll be some changes. We're gonna be adding some money probably to our part-time salary line now that we filled our part-time engineer. We definitely have overtime costs, which I would expect to see increase more over the next few months because of summertime programs that are done. So it's more overtime for our environmental health staff. And currently we've got some on-call, but I don't know that we'll go over that budget. We're doing some on-call for some of our rabies coverage, but we'll talk about rabies a little bit. We've got some plans on how to address some of those costs more reasonably. Page 3, we go down toward the bottom. Kind of nice to, if you look at this second to the bottom, the auto expenses. We're giving some money back to the county. There's grant reimbursements for our mileage payback due to many of our grant funded programs. So better than budgeted. Page 4, nothing out of the ordinary. Page 5, professional services. It's definitely going to go up, right? It just shows in the first quarter 3%, but we have a number of costs that will be hitting this line that we expect to, that we expected and budgeted for, but then there are some costs for rabies that we know we will go beyond. So for example, in our professional services, we have some of the contracted engineers that we already use, Paychecks, which is a required program to do some background checks, diagnostic and treatment center cost reports, right? Those are all services that fall under there.
I mean, it shows you use little to date, but you're going to use it. That's what you're saying.
Using it.
Yes.
And we will likely use all of it and perhaps need to put more in there. Again, referring more to our ratings and our contract services for that.
You moved money last year into rabies for the same reason, right? From your budget?
Yes, we had a really good thing going with our previous people who did our rabies control program, but they retired. So we have a number of contracts. We'll be coming next month with yet another contract. And we're also going to speak to it now, try to create another part-time rabies position within, so it's an hourly rate. So then we'll have 2 part-time positions because our primary person simply cannot be available 24/7, 365. That's not a reasonable thing to ask. So if we are able to hire another part-time position, then that will
the pay at the hourly rate is better than the on-call rate and overtime rate that we're paying our sanitarians in the interim.
Yep.
Let's go to page 6. Talking rabies again.
Mm.
This is, as we go midway down there, you see that at 78% of our budgeted line has been hit. There were a few bills from the hospitals that we held at the end of last year, and carried over into this year. That's why there's more than typical right now. Plus just the ordinary prophylaxis treatment that people are receiving. We would anticipate when we do a resolution, and probably we'll consider doing this in June, Rosalind, Dan and I will look at where things are at. Taking it from our salary line, because of our vacancies, we have salary money. Okay. Page 7 and all the grants, they level out. So I think we'll just skip through all the grant pages.
What page we jumping to?
And we'll go to page 13. We'll talk early intervention midway down the page. Right now, the health fees are a little lesser, but we're not really concerned as far as the revenue because, again, the State Department of Health is going to pay us what they're going to pay us. But we've not had situations where they don't pay us. So we're not especially concerned at this moment for that. The same with the very last line there, the state aid for early intervention. Well, there's nothing here at the moment. There's no reason to assume we will not be paid, but the State Department of Health is notoriously delayed in paying us for that. The last time we were paid was mid-2025.
Kathleen Rosen, when we met previous to this, you guys talked about or stressed that as far as the county's local share of early intervention, it is far less. It's not, I don't even know what the local share for EI for 26 actually is in the budget, but it pales as comparison to the local share the county has to pay for the 3 to 5 program. Right? I mean, okay.
Page 14, we'll just look at a few more, one more early intervention before we get into the preschool special ed. On related services, our early intervention expenses, there is a 5% increase for service providers that was not included in our budget because the state had not passed that. There had been conversation about it. It is now passed. It's going to be just over $27,000 in retroactive payment that we can anticipate. That goes back to October of 2024.
Wow.
Through April of 2026, and then of course ongoing. There will be that.
The county has to do the retro part?
We do.
Okay.
Yeah, and they're letting us know. We have this escrow program.
Mm-hmm.
They'll tell us what we need to put in there. Mid-page, we'll start talking about it looks like education of physically handicapped children. That's our preschool special education program for children ages 3 through 5. As far as health fees, the Medicaid revenue, it says 0 right now, but again, we're not especially concerned about that one right now. It is State Department of Health pays that. A lot of times it's just the timing of when the billing goes in and we get payment back. Our McGinnis electronic system for this program is very helpful. It keeps us on task and we submit in a timely manner. So again, at this point, we don't anticipate we'll have any issue. We should be getting our revenue. If you move down a couple of lines and you look at the state aid line 43445, that has to do with service and evaluations and CPSC administrative costs. New York State Education pays that. It's 59.5% of all our services. That one, we submit and we seem to take a lot longer getting paid from state ed than we do from state health. We anticipate being paid, but we have not been paid at the moment. page 15. Salaries. We've got some overtime. It really is, it's our early intervention service coordinators who are our overtime costs primarily. And that's because the service coordinators need to work with families to provide their service. And a lot of times, if you have working parents or families, you're going after hours. So there are some overtime costs associated with that. Go to page 16. Midway through the page, talk about tuition. In 2026 budget compared to the 2025, we increased our tuition. There were 2 more classrooms opened where we filled out with Cayuga County children, both locally and out of county. You know, the qualifying children have increased, their needs are significant. So we increased our budget for 2026. It appears right now that we're on target for that budget line. When we go down the next line to talk about transportation, again, it's a little bit of a crapshoot, right? We base it on past practice, and we do have contracts with our transportation providers. We try to anticipate each school year the number of children that we will be transporting. We try to fill up those buses. We also really work with families very closely. If you have a child particularly who's going to an out-of-county tuition-based preschool program, we encourage families to find a means to transport their child themselves. And we do reimburse those families for transporting their child. And that's a savings certainly to the county if that is able to happen. We did, as all of you are aware, we're extending our contracts with our busing services under our request for proposal option to extend for another year. The bus companies were open to that. We think that is to our benefit. It's not, we can anticipate the increase in the percentage rate.
And the special transporters that you have to end up contracting with, take a county child out of county. I mean, we talked a little bit about it. It could be as much as $600 a day or more to transport a child from here to their preschool program and back. That's just, yeah,
Just very expensive. Yeah. And so if hopefully we're on target there, we'll know better. Again, the first quarter, everything looks good. Okay. We'll skip a few more pages. You'll see some blocked out. That's EMS that's in there. And then we get like to page 19, we're talking about our WIC program. So that's a grant funded program also. So really nothing more to report.
Do you think, Kathleen, it's reasonable to at least, I know you were at the meeting too, consider a driver? I mean, consider trying to recruit someone with a license that would be interested in doing some transportation on behalf of, I mean.
It could be a cost savings. We would use 2 people, right?
Mhm.
Because you gotta make sure you cover every day,
Yep.
days off.
Yep. Yeah, I mean, it either way, it's very difficult to
Yeah,
think
it's
about.
definitely worth looking at.
Yes.
And seeing it is a specialized driver's license,
Mhm.
because you have to have the qualifications as if you could drive a school bus.
Mhm.
I believe that's a CDL license for those of you who are familiar with that. But yeah, it's absolutely worth looking at.
So can we look into that, and investigate that?
Yes, it's probably been 15 years since we've had that happen or longer. We looked into it. We didn't have takers, but it's time to look again. And we
Okay.
And you also talked a little bit about meeting with the BOCES or the superintendent, even Auburn's, about would there be a desire for them to transport and be reimbursed by the county?
correct. And so we're gonna try to set up a meeting for, I thought it would like to the school budget has passed.
Certainly. Yes.
Whatever it's going to be. And then we'll try to set something up to have some discussion, see if there's any cost savings that might be had if the school district is interested in it. Any other questions?
Thank you.
Thank you. Okay. Okay, maybe we will, I'll go over the two, these resolutions that we have tonight, and then we can ask any of the other departments if there's anything they want to add to their reports, or, if you guys have any questions. The first Ways and Means resolution is from Finance, is update our service agreement with Tyler Technology from Munis Software, which is county's financial software. Grace reminded me that we did move forward with a resolution for Munis for a 1 year
Correct.
period of time. This particular resolution is for a 3 year period after this year.
Yes, because at the time of doing the one, Amanda had spoke, she'd be working with Tyler to see if we could, work on the rate. So she was able to do that. There's going to be no increase for the first 2 years, starting 27, 28, and then there'll be a 5% increase in 29.
That's great. Thanks for that work. Yep. So, could I get a motion? Okay,
Second.
all in favor?
Aye.
All right. WM2 is a resolution from Jenny, the real property to pay mortgage tax for 2026. It's an annual resolution you do
It's actually twice a year.
twice a year, okay?
So, we get the information from the clerk's office of mortgage tax that's been received. It's by municipality. Essentially, my office calculates the distribution for the villages, so that's why we.
Okay. All right. Can I get a motion for Ways and Means 2?
Move it.
Second.
Okay, any questions? All in favor? All right, Dave? Is there anything that you want to highlight on your report?
No, I would like to say though that you may recall my deputy Melinda Strobe, who's been with us for many years, retired this last fall. And I ask you if you could see fit to extend a short period of time for her to help us if we needed help through the transition. And she announced today that the 5th of June will be her last day for the addition that she helped us out with.
Okay, I'm confused. Has she exhausted what we authorized?
Well, there's a little bit left, but she's.
And in the amount not to exceed that we put in there?
Correct. And so she's decided that it's time.
Enough's enough?
And, well, enough's enough.
Uh-huh.
And also that Jessica can speed down and so on, so it worked out exactly as we had hoped it would.
Wonderful.
With your insight, it was a great idea, and so she's gonna be done in the next couple of weeks.
All right, great. Anything else?
Let everybody have the.
Any questions for Dave? Grace, you gave us a big report in the beginning. Is there anything you want to highlight on yours?
Nothing on my, report, but I just wanted to, add that, in June, I will be coming with a resolution, working with Jen and Christine reached out to me. We are going to, transfer the position and function of their payroll staff to the finance department, and this is another step towards the centralization that this board wants. So
This is highway.
no,
Nope.
this is DSS.
Oh, DSS. Okay. You're taking the DSS payroll?
Yes,
That's a real big deal. I mean,
well,
Okay.
highway and sure
yeah,
are big deals too, but.
yeah. I mean, in terms of the number of employees.
Yes, yes.
Yep.
So we'll be taking that on and we'll take the function and the position over to finance.
Okay, you'll transition the individual.
Yes, we're working with Diane. We'll be coming forth with a resolution to do
Good
that.
thing. All right.
Okay, I wish Heinz was here to hear that.
He might smile. He might have
No.
smiled.
All right, thank you. Jenny?
I don't have anything to add to my report unless anyone has any questions.
Any questions for Jenny? Okay. Diane, I see you have information here about the recruitment efforts for both. We've got 40 open positions and you're going to be doing some additional research on recruiting for the sheriff, the jail, and for the DSS positions, caseworker.
Yeah, so of the 40 positions, the majority of them are residing unfortunately in the jail and DSS. So obviously we're focusing on those areas, you know. Hopefully, I think we're preparing for the new group of the T&E exam for the custody officer, so that will be coming up soon. And that will generate a new list for the sheriff, along with working with him on doing the physical fitness exam. So hopefully that'll help. And then just again, working with DSS to try to fill some of their caseworker positions. Yeah, and hopefully maybe we'll get some interest with now that college students have actually graduated, who may be interested in going into that field.
And the T&E for the jail, don't confuse it with a help position because they're
Correct.
still, okay.
They still have to test.
Yep.
And they still have to go in and fill out a questionnaire, and then there's a eligible list that is generated from that. So, but it is considered like continuous recruitment, so they're offering it like every quarter now instead of just once a year.
Okay. Any other questions for Diane? Okay. Amanda.
I don't have anything to add. I just would highlight that Doug has a resolution going through for the sewer study for CNS, and the original proposal started at 140,000. They negotiated them down to 66,000.
Good for you. Yeah, that's
Pretty
great.
good.
And the sewer study has to do with,
Emerson Park.
okay, and the fixes that we really have to get underway, is that?
Yeah, and he has a grant to cover, yeah, it's the whole park, right? Yeah, it's the
This is
whole park.
sewer system for the whole park.
Yes.
Okay.
Like
Great.
you want to negotiate a couple other things or?
Yeah, did you get a mean face on or?
Oh, I did it through email.
All right then. All right. No,
Worse.
good. Thank you. Okay, all right, Amy's ill tonight, so I'll go over the HHS resolutions. There were only 6 of them. HH1 and HH2 I grouped together. One is to fill a 100% funded WIC position, and the HH2 is to enter into a lease agreement with ABC Cayuga for the WIC space, both funded by the WIC grant.
Second.
Okay, any questions about that? Oh, yeah, usually y'all, me, all in favor? Aye. HH3 is to fill a part-time aging services specialist that was included in the 2026 budget for the Office for the Aging. I'll take a motion for that.
Move it. Second.
We do this every week.
Yeah, any questions? All in favor?
Aye.
HH4 accepts state funding for a rental supplement program. That's the Department of Social Services. They use it for, subsidizing rent or preventing evictions, and it's to accept the state money.
Move it.
Second.
Any questions? All in favor?
Aye.
Okay. HH5, you could see, was also here as an amended resolution, and that's to renew a contract with the rescue mission. And the reason for the amendment is the amount was amended down from 100 and some thousand to 96,000. So the actual cost was reduced. So we made that amendment.
Move it.
Second.
Oh, any questions? All in favor? Great. And then HH6 is a leave bank for an employee in the mental health department.
Move it.
Second.
Okay, that's it for Health and Human Services.
Thank you. Government Ops has 2 resolutions. One is authorize the transfer funds in the record retention budget. I get a motion?
I'll move that.
Second.
All right. Any comments, any questions?
No, I think that was to move money into a line for conferences. So allowing, go to training.
Yeah, all in favor?
Aye.
Bill 2, I'm gonna have somebody from the clerk, because there's a revision on this.
Actually, if you can do it, or Grace would be happy to do it.
So whoever wants
Would
to
you-
talk a little bit about the revision?
Yes.
I think we just changed one.
Yeah, but I just want,
Grace?
She's
Oh, sorry, the authorization of the county clerk to fill a temporary part-time records retention administrator in the records retention office. The reason the amendment was recommended is because technically to spend that $14,200, it's going to be coming out of a part-time salary line of which the clerk has none.
Correct. There's no budget in the part-time salary line, so we're gonna move the money from the full-time over to the part-time. And the money is there because of retirement. So that extra money, well, the 14,000 that's in the resolution will be moved over.
Because that individual was budgeted full-time and now is just gonna come back on this part-time
Correct.
basis. And
So it's a budget neutral. It's just moving it from one line to the other. So when we pay it, that line doesn't look like it's over. We need to move the budget over there.
I like that. It's one of John Ann's favorite words, budget neutral. Says
That's
a
it.
lot. Move it. It's just,
I'll second.
okay, all in favor?
Aye.
Okay, thank you.
Planning and Public Works,
Thank you, Madam Chair. Planning had 14 when I left last week, there's 15 now.
oh, that is true.
PPW 1 is approving a contract with Thaler Riley Wilson for code review. I believe this is the building and grounds on the post office building. I'll entertain a motion to approve it.
Move it.
I'll second. Yes, we had a lot of conversation about this having to do with the city court.
Thanks to council stepping in. He
That's right.
reminded us of where we left off.
Yep.
Thank you. Glad to help. Awesome. PPW 2, authorizing the employment training director to fill senior employment and training specialist position in the ENT departments.
I'll move it.
Second.
Thank you. All in favor?
All in
Aye.
favor?
Maybe we could just do any opposed.
All right.
Right.
I'd like to bundle 3, 4, 5, 6, 7, 8. If I may, all relevant to the highway department, all went through committee. And unless there's any questions, I'd entertain a motion to approve the bundle.
Move it.
I'll second.
All in favor?
Aye.
Opposed? Sorry.
All right.
Okay, PPW 9 and 10, planning department. All been through committee, authorizing the legislature and the director of planning department to create a planner position help program in the Department of Planning and Economic Development due to resignation of the senior planner and to abolish the senior planner position. 10 is authorizing the legislature and director of planning department to create and fill a senior GIS analyst position help program in the Department of Planning and Economic Development. I'll entertain a motion for 9 and 10.
Move that.
Second.
All in favor? Opposed? Thank you. 11. Determination of environmental impact, sort of clean energy community grant projects at Anderson Park. And authorizing the chair of the legislature to sign part 3 of SEAF.
I'll move it.
Second.
Thank you. All in favor?
Aye.
Aye, aye. Carried. Authorizing the award of a contract on line 12 to C&S Engineering for fulfillment of an environmental planning grant with a match from capital H21-02.
Move it.
I'll second.
Question? Comment?
Could you remind me what that is?
That's ARPA.
Oh, that's ARPA funds?
I think so.
Okay. Oh, you're awarding the contract to CNS and using the capital H to do it. Okay.
All in favor?
Aye.
Aye.
Authorizing the purchase of real storage shelving, Parks and Trails Department.
Move it. I'm not in competition with you now. I could just.
Steel.
take the time.
Steel storage shelving. Yeah, that's budgeted for, Doug?
It's coming out this year, yeah.
Okay.
All in favor?
Aye.
Carried. Again, all these went through committee.
Mhm.
Keep up.
I know, but I'm not on that committee.
14, authorizing to enter into contract with Rare Tree Care for tree removal within Emerson Park.
Move it.
I'll second that.
All in favor?
Aye.
Thank you. Now, this one was added, authorizing the legislature to create and the highway superintendent to fill one junior account help program position in the highway department.
I'll move that for discussion.
I'll second it. Is it
Yep.
budgeted?
This was this was added on, and went through the personnel committee kind of on an emergency. Did it go through the personnel committee?
It did.
It did. And basically, Brian had a resignation of his fiscal staff in the highway department. And this allows him to, offer the position as soon as possible if this passes. And it did include some possibility of allowing the individual that's leaving the job to come back for up to 100 hours of training at the hourly rate of that position, which if she's willing to do that, Brian, it would be some cross training that would be necessary, correct?
Correct.
Okay, I spoke with Brian that there's not concern that he wouldn't have the money in either his part-time or his full-time salary line. So I'll move that.
You're happy?
Huh? I was very happy.
All in favor? That's what you guys.
Oh, okay. All in favor?
Aye.
Carried. Thank God I'm done.
Okay, Tom, would you mind going through the JP?
I'd be delighted to. Thank you for that. JPS has a total of 11 resolutions. I guess I'd like to start off by bundling JP 1, 2, and 3. They are all authorizing the chairman of the legislature and the director of emergency services to accept different grants, with JP 1 being to supplement the funding of updating the hazard mitigation plan, and JP 2 and JP 3 are for the purpose of enhancing equipment and technology for the Cayuga County Hazardous Materials Team.
I'll move 1, 2, and 3.
I'll second.
Good question.
Okay.
All in favor?
Aye.
Also, I'd like to bundle JP 4 and JP 5. They are both for filling positions within the probation department. JP 4 being to create and fill one part-time probation officer on the probation department. I believe that is looking for a retired officer who is looking to come back and help bail out the workload in probation. And JP 5, the authorization to fill one probation officer due to a resignation in the probation department.
Move it.
I'll second.
All in favor?
Aye.
JP 6, agreement with the Stop DWI with FLX Media to promote the Stop DWI program.
I'll move that.
Second.
All in favor?
Aye.
JP 7, for the sheriff to accept the grant from the New York State Canal Corporation.
Move it.
I'll second that. What is this for, Sheriff?
So this would allow us to get reimbursement when we patrol our navigation division on Cayuga Lake or the canals cross lake. Anything that's connected to the canal, we get 3/4 reimbursement rather than half that we normally get from the state. So there'll be significantly more reimbursement through this grant.
Okay, thank you.
All in favor?
Aye.
JP 8, to allow the sheriff to sign an agreement with Port Byron School for special patrol officer to have a school resource officer in Port Byron School.
Move it.
Second?
I had a question. So is that state funded or is that coming out of the sheriff's budget?
That is funded by the Port Byron School District. Correct, Sheriff?
Correct, 100%.
All right.
All in favor?
Aye.
JP 9, also allow the sheriff to sign an agreement with Offender Watch used for platform for management of sex offenders.
I'll move it.
Second.
Any discussion? All in favor?
Aye.
JP 10, JP 10, authorized chair of the legislature and the Cayuga County Sheriff to purchase one drone and necessary accessories.
Move it. Move for discussion.
I'll second.
What is the drone used for, like, in this case, like, and is there any extra training or anything that needs to come with the drone? Like, is there like classes? I'm sure.
They do receive some training, but we use it for missing persons or to document crime scenes, or we actually have a drone that we can fly into a building or home if there's a, you know, potentially dangerous individual in that location. If we want to get eyes on in there, so we use it for a number of different things.
So the cost was about $12,000. So is that for the drone or is that for all in at $12,000? Is that $12,000 plus training and all that?
That would be for the drone and software updates and that type of thing. I don't know that there's any paid training in there. I think that the operator that's going to get the drone doesn't need any initial training, but I don't believe that there's any training included with that one.
So you're all in at 12, roughly.
Right.
And Sheriff, this adds to a fleet that you have that is kind of worn out,
It replaces one of four.
one of
That
four.
were purchased in 2020 and they're just, the software is not supported anymore. We can't get batteries for them. The technology is getting outdated already, so it's replacing one of four. We do have others that are gonna soon need to be replaced, but we're just looking to replace one now, given our situation.
They're very cool.
Mm-hmm.
I know.
I've seen demonstrations of them at the Employment and Training Youth Development Program last year when the Sheriff's Department was there for kids interested in criminal justice, and they had them all outside. I don't know if you remember seeing that. But they had them all outside, and it was fascinating. It really, that drove the kids' interest a lot.
They're a great tool for what we do.
How big are they? They're like the typical drone size?
They are, if you want to come out sometime.
That fly one?
I don't know about that. Resolution for another one maybe.
All right.
Yeah, we can give you a demonstration.
All right. I'd like to see that.
And Sheriff, the phone account that you're taking this from, that is a balance that fluctuates all year long? Because it's based on what people pay to use a phone, I mean,
Correct.
okay.
Any further discussion? All in favor?
Aye.
All right,
JP 11. Authorizing the chairperson of the Cayuga County Legislature to sign contract with the New York State Office of Indigent Legal Services and amend the budget.
I'll move that.
Second.
Any discussion? All in favor?
Aye,
All right, yeah, that concludes JPF.
all right, and
Like ledge one.
there's, ledge one is on for information only. It'll be coming to the ledge meeting next week. Authorization to fill one 911 administrator in the Cayuga County 911 Center. So it's information only for tonight.
Need a motion to adjourn. Do it for you.
Okay, thank you.
All right.